Okay, we are saying diffusion about osmosis through a membrane. Roll 45. 46 is absent. 45. So she was speaking of membrane osmosis, semi-permeable membrane. So what do you think what properties of the membrane do this diffusion or osmosis depend on? Generally, diffusion may not be through a membrane, osmosis is through a membrane. Okay, anything. What properties of the membrane does this depend on? This diffusion and osmosis. Semi-permeability of the membrane. Okay. Can it occur if it is fully permeable or if it is impermeable? Impermeable, no. Say fully permeable. Particles would not be separated. Okay, so it is semi-permeable. Okay, any other property? Fluidity. What do you mean by fluidity of a membrane? Allows the particles to, that is the permeability. Then what about fluidity? What other physical properties may be of a membrane, or of anything? Say this curtain, like a membrane, semi-permeable. If we think of small molecules, even this can be thought of as a membrane. Just I am giving an example because these have holes in it, very tiny holes. Obviously, this paint can't pass, but air molecules can pass to some air can pass to some extent. So, what do you think the some physical properties of this curtain? Does it have a length? It has a breadth. It has an area. It has a thickness. So, does it depend on those things? Diffusion. So, how is it related to area? Area of the membrane. If the area increases, diffusion will increase or decrease. So, that question was displayed, which came in this February-March exam. One short note was there, bile salts. So, you have to write, not in short notes, you have to write not only names, you have to write about it. So, name of the salts. Whoever is asked, answer and don't prompt. Cholic acid. Cholic. So, do you think acid and salt is same? If you have read elementary chemistry, studied. Salt will be what is a salt? Sodium potassium compounds of so which acid? What are the names of bile pigments? Bile salts are separate, bile pigments are separate. What are the names of the bile pigments? (43) roll. What forms the structure of heme? Structure of what? What did you say? Structure of heme. Heme. Don't talk. Don't make sound. Don't make any sound. Be quiet. Protoporphyrin ring. Protoporphyrin with iron. Iron in the middle. Roll 42. Heme is one of the parts of the hemoglobin molecule. What is the other part? Iron, she already told. Heme is one of the parts of the hemoglobin molecule. Protoporphyrin ring and iron is a part of the heme. What is the other part except heme? AJ, কি হলো? Globin chains, yes. What are the types of globin chains you know about? Okay, name them. A and B. Roll 40, you are 2. Roll 41. Do you want to add something to the names of the globin chains? He told A and B. Or want to modify? That means in the adult hemoglobin, alpha and beta. Any other globin chain that can form hemoglobin? So, 2 globin chains you are saying. Alpha and beta. 2 beta. Fetal hemoglobin is composed of, hey, কি হলো? So at least there are 4 globin chains, alpha, beta, gamma, delta. This comes out. Actually, there are 6. There are 2 more. Okay. Excellent. Roll 41. Okay. What is the difference in property between fetal hemoglobin and adult hemoglobin? Its main functional difference, or difference which is related to the hemoglobin's, the primary function of hemoglobin. So the primary function of hemoglobin is to carry oxygen. So what is the difference in that aspect between fetal hemoglobin and adult hemoglobin? Anything fetal hemoglobin with oxygen, adult hemoglobin with oxygen, what is the difference? Okay, roll 40. What do you mean by isovolumetric phases of the cardiac cycle? Volume remains constant. Of volume of what? So this is speaking about the volume of what? Hey. Isovolumetric. So iso means same volume. Okay, volume remains constant. Same volume through that part of the cardiac cycle. So volume of what we are talking about here? Is it the volume of blood or something else? What is the duration of a one cardiac cycle normally? 8 seconds. Less than a second, 0.8 second. Roll 38. How can we relate the volume of blood in an adult human body to the body weight? What is the total? Usually we speak of total amount of blood in an adult human. What is the approximately? It's total amount of blood, volume of blood in an adult human being. Better to say by body weight, but even if not, approximately what is the total? What is the percentage of fluids or water? Mostly it is water. So what is the percentage of, or what do we say, total body water with respect to body weight? How much percentage? 75%. Rule 37. You want to modify the this percentage? Total body water as a percentage of body weight or body mass. Don't whisper or talk now. So what is the total body fluids, total body water? We are not go. We have not still. We are not classifying. We'll classify. Okay. The question is total. Again, learn to answer the question. What is the total? What is the percentage of total body water expressed or total body water expressed as a percentage of body weight? Among that, classification will come intracellular, extracellular. Okay, but what is the percentage of body water? So if 90% of body weight is water, everything else is 10%. This is what this means. Muscle mass and whatever is there in the body except water. So what is that? That is not 90, not as great as 90%. So he told 75. So what do you think? What is the total amount of blood in the body? It cannot be exactly 5.5 liter for everybody. So you have to tell a range. It's 5 to 6 liter, or expressed in with relation to body weight, it is 80 ml per kg. If it's a 70 liter, then 80 into 70, it's 5600 ml. So, sorry. Rule 36. Oh. What is a synapse? Yes. Connection. Okay. So are two neurons connected by what? Is it then? Is it a fiber? Not fiber. So neurons are itself fibers. There's a so synapse. You were telling it is another nerve fiber joining two neurons, adjacent neurons. And then what is the neuromuscular junction? Junction between? It comes from the word neuromuscular junction. Junction between? Neurons and? What is the other part? Junction between neuron and muscle. Then neuromuscular junction is, so it's a junction. It's, so what is it made of? Is it made of a fiber, muscle fiber, or a nerve fiber? So you are saying synapse is a connection, a nerve fiber between two neurons, and neuromuscular junction is a nerve fiber between one neuron and another muscle, right? Rule 36. Rule 35. Name the transmitter which is present at the neuromuscular junction. Acetylcholine. Yes. So These acetylcholine, these are called, acetylcholine is present, so these are called cholinergic neurons. Do you know of any other type of neuron except cholinergic neurons? Adrenal medulla has been discussed? No. Okay, leave. Tell me what is motor end plate? Be loud. Skeletal muscle. Yes. What part of skeletal muscle? Don't whisper, don't talk, others. So, neuromuscular junction is not a part of a skeletal muscle. It is a junction of the neuron and the muscle, which she says that this role 36, she says is a fiber, nerve fiber. Role 34. So, do you agree a synapse or a neuromuscular junction is itself a nerve fiber? No. Then what it is? Neurons. It is a junction between, functional junction between two neurons, and it is basically a space. Same thing for neuromuscular junction where acetylcholine is present. What ion is needed for muscle contraction? So don't say also. So that is the main. So calcium. Calcium is primary in muscle. Hey, ki holo? Calcium is primary in muscle contraction. What are the names of the contractile proteins in muscles? Actin and myosin, which we who was role 43 or who is role 43 and 34. You are 34. 33. Can you name other two contractile proteins except actin and myosin? Except actin and myosin? Troponin and tropomyosin. Right. What happened? What is sarcoplasmic reticulum? Sarcoplasmic reticulum. Hey! Don't talk. Let another person answer. Okay, what is sarcolemma? কি হচ্ছে, কি হলো এখন? তো বলতে দাও অন্যকে, কথা বলছো কেন বারবার? না করছি। No, muscle contractile unit is called the sarcomere. Sarcolemma is covering of the muscle fiber. Role 31. Give an example of a symport. Have you heard the term symport? Same direction what? Symport where? Transport between transport across cellular membrane, cell membranes. So give an example of symport. Sodium and glucose, and one antiport. Ions you have to say. Sodium ions and glucose symport. Glucose is not ion. Hello. What is the function of prolactin? Prolactin is a hormone secreted by anterior pituitary gland, pituitary anterior portion of the pituitary gland. What is its function? Okay, name any other one of your choice, any anterior pituitary gland hormone, another. So prolactin is just one of the hormones. So most are trophic hormones. What are the names of the trophic hormones? Already anteriorly discussed. So many trophic hormones. So many means 3 or 4. This is unexpected. Roll 28. Name some trophic hormones. What do you mean by this word, trophic hormone? Why trophic? Name any one trophic hormone. Okay, name any one hormone in the body, in human body, any hormone. FSH. So tell the full form. Whenever you are going in this direction in the Viva, then you think that things are not going well. So name any one trophic hormone from that name. Follicle stimulating hormone. So what is the follicle here? Which follicle we are talking of? Where is it secreted from? Anterior pituitary, follicle stimulating hormone. Okay. So follicle stimulating hormone from the anterior pituitary, what follicle does it stimulate? I think names were known before coming to MBBS. Thyroid stimulating hormone, follicle stimulating hormone. Is it a trophic hormone? Your role? Role 27. Name a disease caused by excess of growth hormone. Growth hormone has been discussed. Acromegaly. It is acromegaly, also gigantism. So gigantism, we call it before the linear growth when possible, before the closure of epiphysis in bones. gigantism, we call it gigantism, then we call it acromegaly. So one or two features at least of acromegaly, what happens? Are there long bones in the face? So when you answer just no, that is what we just told. Gigantism after the closure of epiphysis, if the growth hormone secretion is so that will not lead to length in the growth of the bones, but it will lead to enlargement of hands and feet. Okay. Okay. What is caused due to less? That means less of growth hormone. Dwarfism. Roll 27. Roll 24. What factors cardiac output depends on what factors? Hey, don't talk. Yes, louder. Stroke volume, heart rate. So these are the cardiac volume output is actually the product of stroke volume and heart rate. So whatever factor stroke volume depends upon, that will change the cardiac output also. So what does stroke volume depend upon? Anything to do with the volume of blood which is coming to the heart. Stroke volume, cardiac output, we are speaking of the heart, which is coming to the heart through the veins, venous return coming to the heart and filling the ventricles. So what is that volume called? At the end of diastole, don't talk. তোমার কত এই তোমাদের তোমার কত রোল 39, your roll 37, don't talk. It's called the end diastolic volume. So does the stroke volume depend on that? যদি end diastolic volume খুব কম হয় হার্ট ব্লাডটা পাম্প করতে পারবে, স্ট্রোক ভলিউমটা কোথা থেকে পাবে? So it depends. So that is also called the preload. And what do you mean by afterload? So it also depends on afterload. What is that afterload? Preload is the end diastolic volume. Afterload is. Have you heard about peripheral resistance? Aortic resistance. Yes, that is the resistance. So that is the afterload. So it depends the stroke volume. So that will influence the cardiac output also. So that is one of the factors. Others. Roll 23. Yes. So how does exercise affect diastolic blood pressure? Say a person starts running. How does that affect diastolic blood pressure? And what about systolic? চলে যাও ক্লাস থেকে, ওখানে অ্যাটেন্ডেন্স দাও, চলে যাও, দরকার নেই থাকার। বারবার বলেও যখন হচ্ছে না, অ্যাটেন্ডেন্স নিয়ে নাও, চলে যাও। Systolic will increase, diastolic will also increase. You are saying this. What about heart rate? Someone starts to run, runs 200 meters, comes back what? heart rate will also increase. So, what is the cause of this increase? কেন বাড়ছে এক্সারসাইজ করলে কেন বাড়ছে? What does the exercising muscles, what does it require? What is the requirement? So requirement of muscle is, okay, rule 22. So do you agree that all of heart rate, systolic pressure and diastolic pressure increase during exercise? It remains same or slightly it may decrease also. So what is the cause of this? Vasodilation occurs locally, so that, what is the meaning of vasodilation? The blood vessels get expanded or dilated so that there is nutrients and oxygen can pass easily to the exercising muscle, right? Rule 21. Yes. So when a person changes the posture, the person is lying on a bed, suddenly he is or she is made to stand up. So sometimes change in blood pressure can be noted sometimes, especially in older persons. Okay, the body tries to compensate this change but in older persons. So what is this? What direction should be the change is usually expected? Should the blood pressure, systolic blood pressure, increase or decrease? Supine position to sudden standing position, it will increase, get higher or lower. Suppose you have measured 100 and say 16 mm of Hg systolic pressure in the supine position and suddenly made him or her to stand from the supine position. Will it become will it become 110 or will it become 120 from 116? First say what? Less or more or same? More, okay. And it will become like 120, 30. So why? On standing, there is increase in blood flow. So, is there any? So, why do you think on standing the blood flow should increase? In which direction? Okay, you name the types of blood vessels. You know what types of blood vessels are there in the human body? Arteries, veins and capillaries. So, among these, which is called the capacitance vessel? Among these three? Obviously, among these three, these are the three types. So, among these, which is called the capacitance type of vessel? Rule 20. Which type of blood vessel is called the resistance vessel? Arteries. And capacitance vessel? Veins. And capillaries are also called exchange vessels. So what are the smaller or narrower arteries called? Arterioles. And smaller or narrower veins? Venules. So artery, arteriole, veins, venules, and but the smallest are capillaries. So the blood flow, artery, arterioles, then capillaries, then exchange occurs where the nutrients exchange occurs. Nutrients and oxygen are delivered to tissues. Then the blood picks up this carbon dioxide, the metabolites, the waste products, and they come back to the veins, venules, and then veins. back to the heart. Okay, so that the heart can again pump to the 21. Roll 19. What is the definition of artery? What is the definition of vein? Blood vessel that carries blood towards the heart. Okay. So, what type of blood does arteries usually carry? Oxygenated blood, and veins carry deoxygenated blood. So, can you give an exception to this? Oxygenated blood. And any other example you know of where artery carries deoxygenated blood and veins carry oxygenated blood? Anything in the body? In an adult human body, nothing else. Okay. So, but there is another example. This is the hint. Much hint greater than this cannot be given, because then I'll have to tell you the answer. So, one is nothing in the adult human or a human body, that, but anything, any other example. One example is there. So, what is one example where two human bodies coexist? Two human bodies coexist. The simple example is mother carrying the baby. So, which vein carries oxygenated blood and artery carries deoxygenated blood? Umbilical vein carries oxygenated blood and umbilical artery carries deoxygenated blood. Right. Roll 18. After taking food, when a human being ingests food, where does digestion start? It starts in the oral cavity. That it starts in the mouth. It starts in the oral cavity. So, what is there to start digestion in the oral cavity? Yes, that is carbohydrates and fats. Little bit of fat can be digested in the oral cavity, but what is there to digest them? Lingual lipase, right. Roll 16. Okay. So, she talked of salivary amylase, lingual lipase. So, what are the other? So, these are what? These are examples of amylase and lipase are examples of enzymes, digestive enzymes. So, what are the other sources of digestive enzymes in the human body? Except this saliva, no. Saliva is one source, okay. So, lingual lipase, this is one source. Other sources of digestive enzymes in the human body. That is in the GI tract. So, it should be in the GI tract. So, what are the other sources? Hey, ki holo? So, pancreatic enzymes, okay. And what are the pancreatic enzymes? You said liver. What about the liver? What are the enzymes from the liver? So, bile is not an enzyme. So, sources of enzymes. So, liver bile juice is not an enzyme. So it is not liver. It is pancreas and gallbladder also doesn't secrete any enzyme. Yes. And except pancreas, any other source? Other organ? Stomach. So gastric, what? Protein digesting or fat digesting? You are roll 16. Roll 14. What is the name of the acid secreted from the stomach? Hydrochloric acid. So what is the source of it in the stomach? Oxyntic cell or parent or oxyntic cell, okay, HCl. So what are the names of enzymes of the stomach? Gastrin is a not an enzyme. It's gastric lipase. Okay, what is the function of this acid, hydrochloric acid? So one is that activation of enzymes, or and another is protection from this. It is one protective function against the pathogens we ingest. Okay, roll 8. Its names. Name one hormone secreted from the stomach. Is it an hormone? Name any GI hormone, not stomach, any GI hormone. Gastrointestinal hormone. Secretin. What is its function? Name the parts of the small intestine. Duodenum and parts of the large intestine. That means colon. Out of that, ascending colon, descending colon, and another part. Huh? Colon has another part. Colon is one of the parts of the large intestine. Again, it has 3 subparts: ascending, descending. Another is no. Rectum is not a part of the colon. It is another part of the large intestine. Okay, roll 7. So how can we classify nerve fibers? That is the classification of neurons. But nerve fibers, according to, there is one classification. Like from the exam point of view, question may come that classification of, or they may give the names also, Erlanger-Gassard classification of nerve fibers, or simply classification of nerve fibers. So you can write unipolar, bipolar neurons, so one part of it, but actually it is by the conductivity, fastness of conductivity, diameter of nerve fibers. No, types of nerve fibers according to conductivity and the diameter. More the diameter, if it is myelinated, faster it will be conducting. So some are myelinated, some are non-myelinated. So how do we classify? Okay, okay, yes? Yes, myelinated and non-myelinated is one type of classification which we studied maybe at the school levels. But there is one classification and there are names. Like what are the types of hemoglobin chains? You were saying A and B, say, but it's alpha, beta, gamma, delta like this. So nerve fibers are named as like that. Okay, you tell me what do you mean by neuroglial cells? But what is neuroglia? Are these a part of neuron? Is it a part of a neuron? Neuroglia? Then what is it? Role 5. What is the function of Golgi body? Function of Golgi body. Yes. Okay, you have to elaborate now. Okay, function of ribosomes. Protein synthesis. So ribosomes are attached to which another organelle? What type? Endoplasmic reticulum is of two types. So the one to which ribosome is attached is called what are the types of endoplasmic reticulum? No, that is in Golgi body. Rough and smooth. So one to which ribosomes are attached are rough endoplasmic reticulum. Your role? Fine. Role 4. Give an example of a semi-permeable membrane in the human body. Cell membrane is a semi-permeable. What does it consist of? Lipid and carbohydrate. Can you just elaborate about it? Elaborate about it. How many layers or what are the proteins? Lipid bilayer containing proteins. So how the proteins are present in the lipid bilayer? How are these proteins present? Are these on the surface of the lipid bilayer or inside or what? Both peripheral and integral proteins. So some are embedded in the lipid bilayer and some are peripheral. Okay. Role 3. Okay, what is the ionic basis of an action potential? Which ions are more relevant in action potential? So that is the ionic pair. Which ions? Which of the ions? Only sodium? Potassium. What is the membrane potential from which action potential arises? What is that called? At rest, what is that called? What is the name of the membrane potential? From which the action potential is arising, or we are describing action potential in terms of the change of the membrane potential. So when the sodium and potassium are involved, so first it rises that membrane potential, then again it comes down. So what is that membrane potential called? That is the phase. But what is the membrane potential called from which the action potential we are measuring the change? So that name is resting membrane potential. So resting membrane potential, what is the definition of it? Okay. So 1, 2, 3, 4, 5, 6, 7. So 34 students are present. Okay. So definition of resting membrane potential is okay. So 34 students are present. Out of them, 11 people have answered confidently. That's more or less random questions. Obviously, during Viva exam, not the same easy or the same. Some questions will be easier. Some questions will be somewhat difficult. Some questions will be moderate, but still. So only 11. That is 1/3, and not that they can answer almost everything else, because questions were not asked at that level which that they could answer this so that they can answer everything else. Not like that. So simple exam, I think which you have studied is 7th standard physics, maybe 6th standard, 7th standard, definition of diffusion and osmosis, and that has to be somewhat modified here. So even that definition did not, you are not being able to tell properly. Who can say the correct diffusion, correct definition of diffusion which should be said here? Not like higher to lower. Higher to lower is okay. Even somebody said lower to higher, but that is completely wrong. But higher to lower is still okay. Someone included solids in the definition of diffusion. Yes, solids can also diffuse. So if performance is like that, then you are bound to fail. Bound to. This time in the that means in the second attempt, or in some cases 3 students were there who were attempting the 4th time physiology. 4th time. So batch of 2023, 4th time they attended. So in spite of being very leniently taken exam, there are quite a few students who have got below 50. So if they have got 40, between 40, that means 40 to 49, then they have to score, to make it 50%, they have to score the rest 60 or whatever is left, that percentage in the theory. So if someone gets 40 out of 100, one has got, this is confidential, so don't spread it around. So one person has got 40 out of 100, so he or she will have to secure 110 in theory, which is very difficult. Who is not being able to score 40, more than 40 out of 100 in theoretical exam, that means that includes the Viva portion. So in theoretical exam, he or she will score 110 out of 200, that is not very usual. If he has the ability to score, he or she has the ability to score 110 out of 200, then maybe he or she would have scored at least 55, 60, at least like that here. So that is proportional, and theory papers will be checked randomly outside. Nobody will know who are checking whose papers. No, there is completely blindfolded. The way it should be actually, complete blindfold. So times were there when maybe people used to know that. Okay, so at this college, not own institution papers, but this institution, but there is nothing. So it can be totally random. So 50 papers are being sent to one examiner. So even there are chances that those 50 papers are from 5-6 different institutions or more. So the maybe the system detects it. So that papers are distributed, the system, the all the papers are scanned and uploaded in the system, then system distributes it randomly, and then they are distributed to the examiners. So you can judge yourself that what is your position. Although this is a hematology or this is a practical class, we just discussed some theory. I am quite ill today. So 30-40 minutes are left. We have done everything, means except the nervous system, everything is completed in clinical. So 40 except the nervous system, that is GI has been done, CVS, SP3, general physical examination. So 34 people are present. Make 6 groups. 6 will suffice. 6-7 groups, 5 people each, and practice upon yourselves. However you like, whatever you like. I am there. I am quite ill. I'll help you if you require. But utilize the time and practice some clinical physiology, whatever you want. But be careful. Take the practical clinical books. Be careful. This is your position in Viva or the theoretical portion. This is your status. I am saying on average. Maybe 1 or 2 people, okay, they have prepared well. But all these things have been discussed. Names of some anterior pituitary hormones you should know from earlier, before coming into MBBS. Or if not, so name any hormone, that will not be the type of question. That was just for asking here. Hospite clubbing is noted at knee joint দেওয়া হয়েছে, মানে mark the incorrect, which is wrong. মানে right statement গুলো তো কঠিন থাকলেও clubbing is noted at knee joint যদি দেওয়া হয়, তাহলে that is the wrong statement. তাহলে এইটুকু তো বুঝতে পারা উচিত, সেটাতেও লোকে ভুল। ওই রকমই অবস্থা হবে পরীক্ষার সময় যদি প্র্যাকটিস না করো আর না থাকে সবার। প্যালট, সায়ানোসিস, জন্ডিস, ক্লাবিং, ইডিমা, এগুলো প্র্যাকটিস করো। করো তো প্যালট। সি প্যালট ইন হার। নোট ফর প্যালট। হোয়াট আর দ্য সাইটস, প্রথমে বলো হোয়াট আর দ্য সাইটস। Tell me first. Eyes, which part of the eyes? You turn to এটা কি দেখবে, কোন part, which part? What about consent? এটা কি হচ্ছে? You when you clinically examine, you have to take the consent. Don't straight away pull the eyes like that. So eyes, other areas are tongue, nail beds, okay, palm or creases. So whether these have become pale. So you don't pull the eyes like that before. Take the consent that I'll do some examination on you. Please cooperate with me. After that, and when you do it with both hands together. See both the eyes. Don't make these mistakes. What are you doing? Examination of একটু উপরের দিকে, from right iliac fossa towards the আরেকটু হাতটা ওইরকম যাবে। তাহলে ওইভাবে তো র্যান্ডমলি করলে হবে না, তাহলে সাবজেক্টকে ঠিক করে না বললে। সো বলতে হবে তো, তাহলে কি করনি? হ্যাঁ, ওদিকে জোরে না হোক, নর্মাল শ্বাসই নেবে, অথবা ডিপ ইন্সপিরেশন অর নর্মাল, আপনি শ্বাস নিতে থাকুন। এগুলো বলে দিতে হবে। দিস কমিউনিকেশন ইজ ইম্পর্টেন্ট। ফার্স্ট ইয়ারে তোমার প্রসেস দেখবে যে তুমি প্রসিডিওর ঠিক করছো কিনা, যে আপনি জোরে শ্বাস নিন, এই কথাগুলো এক্সামিনার শুনবে যে তুমি এগুলো বলেছো কিনা। ওইভাবে র্যান্ডমলি নয়। তাহলে ইন্সপিরেশন কি অত তাড়াতাড়ি হচ্ছে, ও হয়তো শ্বাস নিচ্ছে। তাহলে যখন ইন্সপিরেশনটা হাইট অফ ইন্সপিরেশন, তখন তুমি হাতটাকে চাপবে। ওখানে কি দেখছে ও স্টেথো দিয়ে? হোয়াট আর ইউ নোটিং ফর on the abdomen with the stethoscope? So can you note it in this atmosphere? Difficult, at least for beginners. ঘরে করবে। এখন ব্রেথ সাউন্ড দেখো, স্টেথো দিয়ে দেখতে চাও, অ্যাবডোমেনে অন্যগুলো দেখো, অর্গান পালপেশন, শিফটিং ডালনেস, এই সবগুলো দেখো। If you want to use the stethoscope, not for the breath sounds, that can be heard clearly. Vowel sound ও শোনা যাবে, but better to do in some quiet atmosphere for the beginners. সে কোনো লোকালাইজড কিছু লোকালাইজড, অনেক সময় মাসল স্ট্রেন হয়, এ হয় কোনো, ইট ইজ অ্যাবডোমিনিস, এগুলো তো করবে মেডিসিনে। অ্যাবডোমিনিস সফট, মোস্টলি নন টেন্ডার, নট রিজিড, এগুলো সব মেডিসিনে শেখাবে রিজিড অ্যাবডোমেন কখন হয়। সো দিস ইজ, তো এখন লাগছে, ইফ দিস ডাজ নট গো অ্যাওয়ে ইন সে ফিউ আওয়ার্স, মেবি টুডে, তাহলে কালকে আবার যদি বেড়ে যায় তখন ইমেজিং করাতে হতে পারে। বাট ইউজুয়ালি এখানে ওরকম মাসেল স্পেজম হতে পারে তখন, তো প্রথমেই আমি ইমেজিং করার দরকার পড়ে না। যদি সত্যি সত্যি ব্যথা লাগে তাহলে এখন ছেড়ে দাও, এখন করতে হবে, আরেকজন সাবজেক্ট হোক। চেস্ট এক্সপেনশন এইভাবে করে নাকি? ইউ হ্যাভ টু অ্যাপ্রক্সিমেট দ্য থামস ইন দ্য মিড লাইন, ওইরকম ভাবে করে তো লাভ নেই। হ্যাঁ, যদি করতে হয় ওইভাবে করতে হবে, বা পেছন থেকে, হ্যাঁ এরকম ভাবে এইখানে দুটো থাম দিয়ে কিভাবে বুঝবে? তোমার তো থামসটা কতটা সেপারেট হচ্ছে সেটা বুঝতে হবে। এবং ইউজুয়ালি এইখানে করে সামনে এরকম ভাবে, হ্যাঁ সেটা করলেও থামস তো ওইখানে রেখে কি হবে? তোমাকে তো বুঝতে হবে যে ওটা ইকুইডিস্ট্যান্ট ফ্রম মিড লাইন।